Hello and welcome everyone to this SP.org webinar in cooperation with STAAR and SPIAC-B on closing the gender data gap in social protection. Wishing you a very good morning, afternoon or evening, wherever you are around the world. My name is Rachel Mason. I'm the Gender and Social Protection Lead at the UK's Foreign, Commonwealth and Development Office, FCDO. And I'm the co-chair of the Social Protection Interagency Cooperation Board, SPIAC-B Gender Working Group, alongside Lauren Whitehead of UNICEF. And I'm really delighted to open this session today in that capacity, as today we'll be talking through, or we'll have the authors of a report that was commissioned by the SPIAC-B Gender Working Group on social protection data, and specifically mapping gender within social protection data. So this paper was produced by the STAAR Facility on behalf of the SPIAC-B Gender Working Group, which has identified data and gender data to be a key theme in its work on social protection. So this paper aims to map out what global development agencies are currently doing in their collection and analysis of sex disaggregated data and social protection systems, and trying to identify what the gaps are, and suggestions for and recommendations for how to advance this agenda, which is growing in importance every day. So we'll have the authors of that paper, Palermo and Maja Gavrilovic, talking through that today. And as I say, this was produced on the STAAR Facility, by the STAAR Facility. And for people who don't know yet, the STAAR Facility is the Social Protection, Technical Assistance, Advice and Resource Facility, which is funded by the FCDO as part of under our two programmes, the Better Assistance in Crisis programme and the Gender Responsive Social Protection programme. And it's focused accordingly in these two key areas of gender and crisis. And through the facility, specialist consultants can be contracted to provide independent technical assistance, specialist advice, or bespoke resources. There's information on the slide as you see now, and you can follow the STAAR Facility on LinkedIn to access all the publications and blogs and updates about ongoing and completed assignments. So with that, I'll move on to introducing our key presenters today, the authors of the paper. And then I'll go back to housekeeping, which I realise I've skipped over a slide, but that's fine. So our speakers today are Tia Palermo, who is the President of Policy Research Solutions, or PRESTO. And her wealth of experience in research examines the impacts of social protection, including gender responsive social protection, on areas including economic security, health and well-being. And our other speaker is Maja Gavrilovic, Senior Social Protection Specialist, also at PRESTO. And she's got extensive experience in qualitative research, policy analysis and programme development in social protection, gender, child well-being and food security. So before I hand over to them to talk through some very quick housekeeping. So we are on a sort of tight time schedule today. We're being ambitious and trying to get through a lot. So if you have questions, please do post them in the chat whenever as we go along, and we'll ask our speakers to come back to you if they can in real time, and if not, after the session. And we'll collate and share all the responses in the chat box after the event, so they've been captured. The session will also be recorded, so you can either rewatch it or share it with other colleagues, and please do interact on social media as well. So with that, I will hand over to Tia to start the presentation.
Thank you. Good morning and good afternoon to everyone. I'm very pleased today to be sharing findings from the report that Maja Gavrilovic and I did on gender data in social protection. The motivation for this work is that gendered vulnerabilities contribute to women's higher rates of poverty in many contexts and their lower coverage in social insurance schemes. This is due to several factors, including lower rates of asset and land ownership, as well as financial inclusion among women, lower levels of human capital assets such as health, nutrition, and education. And these in turn can lead to lower rates of formal labor force participation and hence social insurance coverage. Therefore, sustainable poverty reduction can only be achieved by acknowledging these gender inequities and recognizing them as sources of risk. Social protection alone cannot eliminate gender inequality, but there is a growing recognition that gender-responsive social protection does have a role in addressing specific drivers of women's and girls' vulnerability to poverty and their risks. With gender-responsive social protection, women and girls can overcome structural inequities and they can participate more fully in the economy, and this can result in more equitable social relations. The first step in all of this is understanding how social protection works for women and girls. First, we need to better understand with data what are the gaps in coverage and adequacy, and better data for gender and social protection can help us assess impacts of social protection programs and policies. SDG Target 1.3 to implement nationally appropriate social protection systems and measures for all. In order to achieve this by 2030, we need to achieve substantial coverage among poor and vulnerable populations. And first, we need to understand gender discrimination in access and coverage. So just to preview the main points of this presentation, in order to conduct gender analysis of gaps in coverage and adequacy, we first need data which are collected and analyzed in a sex disaggregated manner. In addition, small changes and adjustments to household surveys collecting data on social protection, as well as tools for administrative data collection efforts, can improve our understanding of these gender gaps. And finally, data on gender and social protection is only useful when it's properly analyzed and reported and made available and accessible in a timely manner. Before we go on, I just want to have a quick aside about gender and sex. So sex refers to biological and physiological characteristics of males, females, and intersex persons, whereas gender is a socially constructed concept which refers to socially ascribed roles of men, girls, boys, women, including norms, behaviors, and roles expected of individuals in a society. For this report, we first wanted to understand what institutions are doing in terms of sex disaggregated data on social protection, in terms of efforts related to advocacy, data collection and analysis, and reporting. Next, we wanted to discuss key challenges in collecting, analyzing, and reporting these data. We wanted to explain key gaps remaining to strengthen gender responsiveness of data management systems across indicators, social protection programs, and themes. And finally, we wanted to highlight opportunities and entry points to harmonize or produce synergies across agencies working on data in gender and social protection. In order to achieve these aims, we performed key informant interviews in 2023, as well as a rapid literature review. So I'm going to start with talking about what 3 agencies are doing with social protection and gender data. So the ILO has a mandate to report to UNDESA on SDG 1.3. And the way that they do this is they collect data from administrative sources and they supplement these with labor force surveys. So they collect data from 190 countries every 3 years, and these data collection efforts have been online since 2020. The sources of data include government administrative data, which is supplemented with labor force surveys. Data are only collected on statutory programs which are anchored in law. Some of the data and indicators that ILO collects through the Social Security Inquiry, or the SSI, include coverage, benefit level, eligibility criteria, revenue and expenditures, and these are summarized in the World Social Protection Report, which considers gender extensively in this report. Some of the sex disaggregated indicators collected include both indicators on active contributions for social insurance as well as benefits for social assistance. Some of the challenges for collecting these data is that many countries do not have a single registry or robust MIS, so data can sometimes be incomplete. There may be issues with inaccuracy, and there may be double counting of some beneficiaries in different programs. Turning to UNICEF, UNICEF does several things around gender and social protection data, and I'm going to talk today just about their multiple indicator cluster surveys, which are more commonly referred to as MICs. So these are nationally representative household surveys, which are implemented by national statistics offices with technical assistance from UNICEF. Since 2017, MICs have had a dedicated social protection module, which collects information on benefit categories such as maternity allowance, employment generation, food support, retirement pension, allowances, and other external assistance programs, as well as social transfers. These include social transfers both from government as well as non-governmental sources. Since the implementation of MIC 7, which started in 2023 and is continuing now, data are being collected in a manner which allows for individual level identification and sex disaggregation of these indicators. So some of the questions, for example, ask who in the household receives the benefit, who is authorized to receive the assistance, who is the benefit intended for, etc. And so it allows sex disaggregation of these indicators. Finally, turning to the World Bank. The World Bank also has multiple initiatives, and today we're going to focus on the Atlas of Social Protection, Indicators of Resilience and Equity, which is more commonly referred to as ASPIRE. ASPIRE allows the tracking of global trends and performance of social protection from 141 countries, which covers approximately 70% of the world's population. Data which feed into ASPIRE come from household surveys, as well as administrative data. And programs which are included are those which are financed or implemented by government. The findings from ASPIRE are reported in state of social protection reports, and some of the indicators which are include coverage, incidence, benefit level, level of transfer. And again, some of the sources of the household surveys include household budget surveys and surveys on income and living conditions. As of August 2023, 453 household surveys had been harmonized from 126 countries. So you can see on the slide here, some countries have only household survey data, while others have only program administrative data, but a majority of the countries, as of last year, there were 112 countries which had data from both sources. Administrative data are collected from governments, government reports, budget documents, and include information on 5,000 programs in 127 countries. ASPIRE is currently developing a new tool to process sex disaggregated social protection data, including 20 different indicators by sex. Some of the indicators for social safety nets and labor market programs include gender of beneficiary, target groups, target women, and the percentage of payment recipients who are female. In terms of social insurance schemes, some of the gender sex disaggregated indicators include eligibility criteria, coverage, and the share of expenditures going to women. Thank you. Over to Maja.
Thank you so much, Tia. So part of the study that we have done was also looking at what are some of the data gaps and challenges with both with the household surveys as well as the administrative data, and kind of moving forward with the sex disaggregation data management. And we have found, next slide, please. There are four main challenges which result in the data gaps. The first one is quite obvious. I think that there are challenges in general how social protection data are collected, processed, and stored. We found that there has been a lot of progress in terms of the access and the availability of the social protection data. A lot of efforts have been invested in generating and analyzing it. But I think there are still gaps, and particularly, the sex disaggregation of data adds a kind of additional challenge, and not just the sex disaggregation, but when you have to disaggregate, but other parameters. And 3 reasons for this. Obviously, it's the capacity and the resources. Then there is also kind of awareness about the importance of sex disaggregated data, both at the survey and the administrative level, and the commitments at the national level, as well as, I think, the composition and the size of the social protection systems. And there is obviously a huge variety and huge range across the countries, as well as the agencies responsible for the social protection management of the programs. Now, another important challenge is related to the conceptual and methodological limitations, sex disaggregation, and Tia has already mentioned, I think one of the key things refers to the National Representative Household Surveys, which are often designed in such a way to collect data at the household level. And this is irrespective of whether the actual benefits and the programs are targeted at the individual level. Now, there are also variations in terms of the different types of surveys. There is a lot of efforts, and Claudia from Aspire program will talk about, the work that her team has been doing with the LSMS staff to kind of redesign the survey questionnaires to focus more on the individual level data. Obviously, the Mix 7, as Tia was mentioning, it's also redesigning the questions within its social transfer module to not only look at the household level data, but to ask questions about the individual recipients, as well as get some sort of insights around intra-household dynamics in terms of not only who is expected to benefit, but also, how this is sort of allocated within the household. There are also, and I think in terms of the administrative data, that's mainly focused on the unit of the assistance unit. So it's more commonly that the administrative data is sort of individual level compared to the surveys, and there are different reasons for that. There are also challenges that are very kind of related to the types of social protection instruments. The contributory social security is often predominantly delivered at the individual level, and in terms of the administrative data, that's how it usually gets recorded. There is also, I think, the issue around the contributory social protection, that it's more regulated. There are auditing requirements. So I think the data collection and the storing and the reporting is more organized compared to the social assistance programs, which in many countries, are quite fragmented still. And, there are different types of programs, and often, they sort of they're administered across different agencies, which kind of creates this fragmentation. The fourth reason, or the fourth challenge, relates to more policy and resource constraints. And I think that there is this perception that data work is not seen as sort of attractive for investment and for donors who actually prefer to allocate funds for expansion of program coverage. I think that's very sort of legitimate concern, but it's almost like a chicken and egg issue as well, because I think we cannot really expand the coverage in equitable and efficient manner unless we actually have a very sort of meaningful and adequate data that shows us, who is receiving what and what are the gender gaps in program coverage. Now, in terms of the data, in terms of the capacity building, there has been a lot of efforts already to build the capacity with national statistical offices, and many of these interventions are either ongoing or planned. The ILO, and we can talk more about that with Valeria, they have been preparing the guide and on how to build national systems of social protection statistics, and also undertaking trainings in 2 pilot countries. And I think after the piloting, the publication will be released. Maybe it has been already. UNICEF is also developing the guidance on the gender statistics on how to better use the data to close gender gaps. And the World Bank has been conducting a lot of trainings with national statistical offices, particularly focusing on the LSMS data collection. The kind of general view with the respondents where we were discussing is that staff from the multiple organizations working on gender data or social protection data said that they did not really receive formal trainings on either gender data collection or analysis, or how, this sector. So there's been a lot of, there is a lot of advocacy work that is needed to actually, stimulate demand, to kind of demonstrate how this data can be effectively used to inform policies and the programmings. And I think from a good practice point of view, having social protection and gender leads in the UNICEF and the World Bank was kind of highlighted as being extremely helpful. And, in UNICEF, for example, the social protection and the gender focal point has been heavily involved in helping the mixed staff to redesign the questions to be more gender responsive. So in terms of the data harmonization challenges, I think one of the key ones is there is really no agreed taxonomy or the definitions of the social protection instruments and indicators between the agencies. And this obviously sort of carries across countries and regions. And in a way, this kind of creates a lack of consensus, which hinders the practical coordination. And it can also cause, misreporting as well as the duplication of efforts to collect and report the data. There are also, I think, limited systematic efforts to collaborate at a country level for data. This is kind of there are reasons for this. I think it makes sense because I think these different agencies, not only at the macro level, but also at the government or the national level, have competing demands, as well as the different sort of levels of the capacity. And it's often kind of seen to be easier and quicker to collect or analyze or report the data independently and ad hoc. But this ad hoc bit sort of creates kind of multiple competing priorities for the national social statistical offices. And this is one of the key issues, I think, that needs to be practical issue that needs to be addressed. There are also issues around data protection and confidentiality agreements, and that hinders the exchange of data sources. Now, in terms of the fragmentation, and I think this is very common to the social assistance or the social transfers arena, there is a fragmentation of data sources, especially related to administrative data in countries that have, many schemes, and they also lack unified registries. So that hampers the opportunity to kind of harmonize, to coordinate and triangulate both, the data from the surveys as well as the administration. Some countries have maybe 10 or 15 social assistance schemes, and others are overseeing, thousands of schemes. So it very much depends on the composition of the social protection system as well as the level of the advancement. Next slide, please. Now, despite these challenges to harmonize, we have identified several entry points that can be leveraged to bring the agencies, again, at the multilateral levels as well as the national levels, to work closer on the harmonization, or to open, I guess, the dialogues around how this coordination can be strengthened moving forward. One of the sort of key entry points is it's a United Nations-wide interagency working group on household surveys, and we think that has been identified as one of the sort of main platforms that can be tapped into to sort of build this common language, maybe harmonize and standardize the taxonomy and the definitions, and use that as a policy advocacy to work with national statistical offices to redesign survey questions on program recipients at the individual level, as well as open this kind of new area of work that it's missing in the moment. So not just looking at the coverage numbers, who is receiving what, but what kind of effects that has on the utilization. And I think the Mix 7 and the Mix Plus is one of the methodological opportunities or tools to kind of create a comprehensive gender analysis on social protection benefits. ILO and the World Bank, I think, could better coordinate the administrative data. That at the moment, I think it's very comprehensive and it offers a lot of opportunities, but it's sort of an untapped resource, because I think that there is a little bit of the bias towards national representative survey data. But they could bring this kind of they could open these channels of communication to see how they can better coordinate the requests for the administrative data at the national level, and that joint repositories. Now, in terms of the conclusions, I think obviously there is a growing momentum to expand sex disaggregated data systems for informed decision making. There are also growing efforts to strengthen gender responsive data collection for global, regional, and country level reporting, and I think that's kind of generated more with this kind of great understanding of the importance of gender responsive social protection policy making, as well as the programming. And I think that kind of is stimulating demand for better quality data. As I was saying, that really broaden the scope of data collection in terms of the gender to capture gender issues more holistically and looking at the intra-household dynamics, and not just the numbers on the participation and access. And as we were saying, there are notable examples of cross-agency coordination and harmonization, but still most of the actual concrete activities remain silent. And then obviously, one of the things that could incentivize and strengthen the harmonization and coordination could be the commitments to greater financial investments, which are definitely needed to expand and strengthen the quality and the availability of sex disaggregated data collection. Thank you so much.
Thank you very much indeed, Tia and Maja, for such a rich and thought-provoking presentation. And it's particularly helpful, this report, for me and for the rest of the SPIAC-B Gender Working Group, as we sort of try and strengthen and harmonise gender data collection and analysis, which is a really important theme for our work this year and going forward. So thank you very much indeed. So we'll now move on to the sort of second part of the webinar, if you like, which is a panel discussion to focus in on that question of how agencies are collecting and using sex disaggregated data. And while we just get the slides back up, I will introduce our panelists. So we're really pleased to have 4 panelists with us, representing the different organisations and sort of constituents mentioned in the report. So we've got Lauren Pandolfelli from UNICEF, who's going to speak to the UNICEF Mix initiative. We've got Valeria Nesterenko from the ILO, who is she's a data specialist at the ILO. Lauren is a gender statistics specialist at UNICEF. We'll also hear from Claudia Rodriguez Alas, from the World Bank, who will speak to the Aspire data. And finally, we will hear from Gilbert Kaponda, who works in the Ministry of Gender, Community Development and Social Welfare in Malawi. So really pleased you can join us today. Thank you very much. And I'll remind you that we're running tight on time, so I'll ask you to keep to 5 minutes, and I will very rudely jump in and cut you off if needs be. So Lauren, to you first. What can the new questions on social protection in the mix survey tell us about gender and social protection outcomes?
Thank you. Thank you for the question and for the opportunity to participate in the panel. So very quickly, for those who may not be familiar with MIXED, the UNICEF-supported multiple indicator cluster survey is a child-centric international household survey program that since 1995 has worked with countries to collect data on children and women. It is a major source of data for tracking progress towards the SDGs and is one of the largest sources of internationally comparable data on women, children, and their households. So as Tia mentioned, in the 6th round of MIX, which ran from 2017 to 2022, a new module on social transfers was included in recognition that social transfers are the most direct ways to protect children and their families against poverty and address the financial constraints they face. In the 7th round of MIX, which launched just last year, we included new questions that ask about social transfers received at the individual level. In other words, instead of only asking, does anyone in your household receive a transfer, we now follow up with who in the household is the transfer intended for and who in the household is authorized to receive the transfer. This information allows us to better understand at the population level whether social transfer programs are reaching women and girls, and to what extent women are authorized to receive the benefits that may be intended for them or for their children. We can formulate such indicators as the percentage of women and girls living in households receiving specific type of support in the last 3 months who are the intended beneficiaries of the support, and percentage of women and girls living in households receiving specific types of support in the past 3 months who are authorized to collect the benefit. It also allows us to look at how transfers are distributed within the household. For example, whether boys or girls are more likely to be the beneficiaries of social transfers. And because MIX collects key socioeconomic data on households and household members, we can undertake intersectional analyses to better understand which women and which girls receive transfers by such characteristics as ethnicity, marital status, educational status, household wealth, urban-rural location, etc. And finally, we can unpack the relationship between access to social transfers and other outcomes in women's and girls' well-being, such as those living in multidimensional poverty, child protection outcomes, such as child marriage or violent discipline, and health and nutrition outcomes, just to name a few. So really, because it mixes a multi-purpose household survey, it really opens the door to a wide set of analyses where we could better understand issues of access to social protection and the outcomes in children's well-being that UNICEF cares about. Thank you very much. I'll stop there.
Thanks very much indeed, Lauren. And as a reminder to others, please do feel free to post any follow-up questions in the chat, in the Q&A box, and we'll try and answer those or answer them after the session. Brilliant. So I will come next to Valeria Nesterenko. And Valeria, I'd love to ask you what the status is of the ILO guide on building national systems of social protection statistics, where that's up to, and what the key lessons were from piloting the guide in 2 countries in 2023.
Thank you very much for the question, and thank you very much for the opportunity to participate in the webinar. So just for those who did not know about this initiative, just a quick recap. The ILO has been working for the past several years on building a guide on developing national systems of social protection statistics in the countries. And it kind of came, as an idea to the ILO to record all the positive experiences that we see nowadays on the expansion of the national databases and inclusion of more and more data disaggregation. Of course, despite of this progress, we still see that there are considerable challenges that are faced by the countries, and they were already named by the presenters, so I'm not going to go much in the details. But we do have good practices from the projects that we have in the countries and the technical assistance that we provide to the countries. For example, via the Action Portugal project, where this whole idea of the guide actually started, we have Lusophone countries in Africa and Timor-Leste who have been working already for 5 years to bring together their national institutions and to form working groups on social protection statistics and to publish the national bulletin. And all these countries right now are at different stage of developing the bulletin. For example, Mozambique already has the 5th bulletin ready, and it's fully nationalized. So it's the country that annually produces this bulletin. Cabo Verde opted for a bulletin plus a dashboard, an online dashboard, which as well brings their institutions together every year. And now they have 3 versions, so 3 years in a row they have been doing the updates. As well, we have other regions, for example, in Jordan, they're working on the national bulletin. El Salvador, Colombia, given the importance of the SDG 131 and the reporting process, they as well brought together their national agencies to do the updates and to report to the ILO and have their national reports annually. We have been working with India for the past probably 16 months to at least have more disaggregation for their national level data. And I'm happy to say that in the next World Social Protection Report, we will have disaggregation of social protection indicators for India by sex. So all of this interesting country experiences, of course, will be a part of the World Social Protection Report, and you will see the significant increase in data availability generally, but especially in the gender disaggregation of at least some of the indicators. The World Social Protection Report will be published in September this year, together with the dashboards. So as we saw, other countries have been requesting the same kind of assistance and trying to establish the same working group. Therefore, it was decided to work together with ITC, it's International Training Center of the ILO, it's based in Turin, to work on a guide for these countries who are interested and who require this assistance, and as well to develop training materials alongside and specific training courses for the guide. So the main objective of the guide is, of course, to provide ILO constituents, so governmental institutions, workers and employers organizations, as well as policymakers, practitioners, and other national stakeholders with a practical tool to assist them in developing and strengthening national systems of social protection statistics. The guide will be particularly useful for the social protection institutions that are dealing with administrating social protection programs, and as well compiling data on social protection as a part of their mandate. So the guide is focusing not only on the social security inquiry and administrative data, but as well on the questions that could be included into the labor force surveys, which ILO is working on a lot as well with countries, but as well use of other household surveys for more in-depth analysis. It's looking on how to build national working groups on social protection, how to better communicate the data nationally, how to identify the needs of the country and actually select the needed indicators from the spectrum of many indicators on social protection that could be there, how to disaggregate the data, not only by sex, which should be, of course, the primary goal, but as well by migration status, by age, by disability status, etc. So with all this aim, we had the first version of the guide ready summer last year. We had 2 pilots, one in Egypt, one in Eswatini as well. Yeah, I'm finishing. One in Egypt, another one in Eswatini last year. And as well, we introduced a course in the Social Security Academy, which is in Turin every September. So now social protection statistics is one of the elective courses there. Last time it was first introduced in English and in French. We have noticed that there is a growing need. It was a growing need from the two pilot countries, Egypt and Eswatini, but as well in the regions and in other regions. There is a particular need for a national dialogue with all the national stakeholders, so everyone is on the same page regarding the indicators, the working groups, and what is coming next. It is important to give appropriate amount of time for learning, desk review, exchange of opinions, and as well sharing from other countries. We usually invite a representative of another country like Mozambique or Jordan, or another country that had a positive experience on social protection statistics. So the idea is that the guide will be published at the end of October this year. It's currently being edited. It went through peer review. Now it is edited. But however, we are fully concentrated on the World Social Protection Report, which is our flagship report, and the dashboards that are coming out in September. After, we will have companion reports coming out of October, and after that, by let's say end of October, beginning of November, we will have a guide published in English with the aim to translate it to Spanish for the beginning of next year, and probably later on to French. We expect it to be a living document, of course, and to add more and more experiences into the guide throughout the next years. So this is where we stand. Thank you.
Brilliant. Thank you very much. Looking forward to seeing all that be published in the coming months and years. So Claudia, I'll turn to you next. So Tia, in her presentation, talked about new efforts in Aspire to collect sex disaggregated social protection data. Can you tell us how this is going and what successes and challenges you've encountered so far?
Sure. Thank you very much for having me today. Well, yes, we have been making a lot of progress, and I am excited to tell you what we have achieved this year. For the last 2 years, we started a process of re-engineering our software and our data production process to be able to disaggregate not only household survey data, but also administrative data. I'm going to focus today on our progress on household surveys, as Maja and Tia explained, sorry. Today, so in the last year, we increased the number of our surveys from more than 400 to almost 518 surveys for 129 countries. So we basically added 71 new surveys. So we applied the new re-engineered process to these 71 to see how it went for the sex disaggregation. We focus on disaggregating 3 types of, stakeholders, let's say. Direct and indirect beneficiaries of social protection programs, direct beneficiaries, and program recipients. Because each of these, roles have different objectives, right? So we wanted to see the spectrum on the 3. So for all of the 71 surveys, we disaggregated social protection data by sex for the 71 surveys for direct and indirect beneficiaries. What we found is this is basically not as informative, because what we really get is the sex allocation between the household, which on average worldwide is almost 50-50. So you don't see very much difference between men and women. But still it's informative, because we can say, we can still look at indicators of coverage, incidence of beneficiaries, and average per capita transfer. But this kind of, kind of makes invisible who in the household has the access to the transfers. So for this, we really need to have sex disaggregated data. So then we went into looking into direct beneficiaries of social protection programs. But for this, we needed to know the assistance units of the program. So the first challenge that we encountered is that household surveys don't identify the assistance units. This is something that we get from administrative sources. So we have to basically go and see from admin data what's the assistance unit of the program to be able to tag in the household survey which programs are, intended for the households versus to the individuals. So this is the first challenge. So we are still identifying, out of all the programs in the 71 surveys, which assistance units they belong to. And it depends, for example, the surveys might add in one question different programs of different assistance units. So we are not able to identify the assistance units, and as a result, it's really challenging to the sex segregate for direct beneficiaries. But it's possible as long as we have this information, or if the survey captures this information. Then third, so we then focus on sex disaggregated social protection data for recipients. So the first step was to review the 71 surveys to see which one had questions captured at the individual level. So out of the 71, only 27 captured data for all the programs at the individual level. 38 had a mix. Some programs were captured at the household level and some at the individual level. And six surveys only had household level, data. So for this, we basically kind of sex disaggregate and data. So what we are at this point is we are focusing on the 27 surveys with individual level data, because for those we can talk about the social protection system for the country in general, right? For the ones that have mixed data capture, we can just focus on those programs captured at the individual level, but we cannot say anything on the overall social protection system of the country at the individual level. So for the 27, we generated the indicators on coverage, incidence, and average per capita transfer. And we also calculated the overall social spending that goes to women and to men. So why did we do that? Because we are working on this analysis of see out of this program, if they are able to mitigate or if they exacerbate the gender difference or the sex difference in labor market earnings. As Tia explained at the beginning, many of the inequalities have the roots in the labor market, right? So the inequity in labor market participation generates all sort of issues, having women, to earn less or to not able to participate in the formal market. So overall, it's almost universal that women have less labor market earnings. So what we wanted to see is how much or the degree of mitigation that social protection benefits can have into this in labor market inequality. So we went for the 27 countries, we produced this aggregate social protection spending and ranked the countries by how much, they mitigate if you compare the difference between labor market earnings and the difference in social protection spending. So we have mixed results, with some countries being more gender sensitive than others that we might call kind of regressive, in the sense that the social protection benefits, the overall spending goes more to men. So the results of this analysis will be featured in the upcoming State of Social Protection report. That is also going to be, it's upcoming. We hope it's going to be launched about September also. So stay tuned. This is, our flagship program that is gonna feature the data that we have been processing for Aspire. I think I am about time.
Yeah,
so I stop here. Thank you.
That's brilliant. Thank you, Claudia. Sounds like September is going to be a busy month for all of these reports, but really look forward to seeing that come out. Thank you very much. So our final panelist, I'm going to turn to Mr. Gilbert Kaponda. And my question for you is, why are data on gender important for Malawi's social protection programming? And what challenges still remain in using these data most effectively? We can't hear you. I think you might be on mute.
Hello.
Hello.
Thank you very much.
We can see and hear you.
Thank you very much, moderator. Thank you very much also for giving me the opportunity to articulate some of the issues according to the question that you have posed on behalf of the Ministry of Gender, Community Development and Social Welfare in Malawi. I want to just highlight some of the issues that sex disaggregated data is doing in our country, its importance and the challenges that we have at hand. First thing first, Tia, I want to highlight the point that the Malawi government recently has taken cognizance that the social protection is important and it lies on the agenda setting table of the country. And by that, we are appreciating the fact that there are various social protection interventions that the country has. But one of the flagship intervention or program is the social cash transfer, where I'm working and where I'm coming from. You see, we have for the recent years worked hard to generate data. Our data largely comes from the Unified Beneficiary Registry, which was ushered in around 2016, 2017, after realizing that there were really shortfalls that we could not appreciate that data that was coming from various programs. So we are tapping all the data from the national database, which is for the social protection particularly, which is the Unified Beneficiary Registry. And the social cash transfer program generates its data, particularly when we are doing enrollment of the beneficiaries. And at that time, we inject that data into the MIS. We have got a very robust MIS, which has stood against the time, and it is one of the reliable database, the system, which can clearly translate the data, analyze the data according to what we want. Let me also mention to say that this MIS gives us various analysis of the data. For example, in our program of the social cash transfer, we have got over 293,000 beneficiary households. Of these households, we have got over 1,283,000 household members. Now, for that, it has to be well analyzed because we need to appreciate what their needs are. So, for example, the female category, there are over 70% of the households. And in terms of membership, we have got over 56% female members within the program. That already tells us that there is something that as a country, we need to rethink, or we need to think on which interventions we need to provide to this. So when we are providing cash transfers to these households, and particularly focusing at, for example, women who have got a critical role in households, and particularly also in the whole country, women and girls are at the center of the development agenda of the country. Because should we leave women and the girls aside, they are left behind, obviously the country will be heading towards danger. So we have got a number of programs or interventions that have come out, because the sex disaggregated data is pointing at the vulnerability of these women and girls. So, for example, I can highlight to you, my colleagues here, that so far the Malawi government has ushered in an intervention, a program which is called Social Protection for Gender Empowerment and Resilience, which is seeking to address the challenges that women have because they are marginalized or because they are vulnerable to a certain extent. Now, extending the importance of social protection, you will see that the social protection is also giving us a clue that these women need to be empowered economically. Because look, women are the ones that look at the affairs of the household, and if they don't have access to income, they are always putting the house in a mess, because obviously they are the ones that will be grappling with any challenge that comes on their way. So we have got now various village savings and loans groups that are created, so that at least when they receive their cash from the cash transfers, they can start being contributing towards having their monies multiplied up. This is a way of trying to realize that the gender disaggregated data was informing us an important aspect that we needed to address. Moving forward, for the girls particularly, we also have got interventions that are arising, like skills development programs, tailored for the girls at least to rely upon themselves, because we are realizing that for us to break the cycle of poverty, we need to also dwell much on how best we can assist girls, not leaving aside the boys. But you see, when you educate a girl child, you are also educating the whole society and the whole country.
I couldn't agree more. I'm afraid I'm going to have to ask you to stop there. We're running really short on time. We've only got a minute and a half left. Okay. But I'll encourage people to put their questions to you so that we can follow up in writing, as I'm sure there'll be loads of interest in the rest of what you're going to say. So I'm very sorry that I've had to cut you off. I'm going to ask all the panel just to put their cameras on for the last minute, as I thank you all very much indeed for speaking today, to our presenters, Tia and Maja, and to all four of our panelists for such insightful answers. I think you'll agree we've tried to get through a lot. And as a result, we've had some really interesting thoughts. But I think this is probably feels like the beginning of hopefully a much greater emphasis on data going forward. So in terms of next steps, as I said, the session was recorded, and so do pass it on, and we will send around the answers from the Q&A session in the chat as well. So many thanks indeed for that. There will be a feedback survey to fill in. So when you see that, please do fill that in. Let us know how you find this session and give any feedback that you can. So I'll thank once again all of our presenters, all of our panelists. Thank you to everyone who could join today. And hopefully this helps inform your work forward and maybe makes data a little bit more sexy, a prospect to work on. All right, thanks very much, everyone. See you soon.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye.
Thank you very much.